Welcome to the Catalyst Podcast. I'm your host, Charles Epstein. If you are among the many people confused about the big, beautiful bill that's barreling through Congress and its implications for Medicaid, we have just the guy. Al Guida is the founder of Guide Consulting Services, a 25-year-old consulting practice that helps corporate, government, and nonprofit clients navigate Washington policy processes to achieve measurable goals. Al and his firm specialize in healthcare reform, Medicaid reform, and veterans' mental health care. Al, how are you?
I'm good, Charles. Thanks for having me on today.
Oh, you are, again, the perfect guy. Timing is great. We're talking this afternoon, June 20th. As we talk, most of our podcasts are pretty much evergreen, but we are going to be talking about this bill, the implications for Medicaid. So this is obviously a fast-moving thing, and we're probably going to want to revisit this shortly after, because I'm sure what we're looking at now is going to be a little bit different from what it's going to look like several weeks. Let me begin, Al, by asking you, okay, well, one big, beautiful bill. It is big, and it is a bill, but is there possibly a more apt word for beautiful?
Yes. Well, Charles, what I would say here, first of all, is that was a lovely introduction. What I actually am is a contract lobbyist in Washington, D.C., so that means I'm among the lowest forms of human life. So we have to begin with that, and I am lobbying this legislation, full disclosure.
And you also are an attorney, am I correct?
I am, and I graduated from law school, although I'm not a practicing member of the bar here in Washington, D.C. And just full disclosure, I'm actively lobbying this legislation on behalf of providers, mental health and addiction treatment providers, and patient advocacy organizations. Mm-hmm. For those clients, it is mostly a big, ugly bill, I have to say. It is not beautiful. It is beautiful if you're getting the tax cuts under the legislation, not if you're being subjected to the Medicaid provisions in the bill. And then I think, Charles, we have to sort of step back a little bit, right? So when we were in this situation last in 2017 with the Obamacare repeal and replace, which is what it was known as then, many somewhat similar provisions, that bill failed through John McCain, the sainted John McCain, because it was a freestanding healthcare bill. This legislation, on the other hand, and I was reminded of this at a fundraiser by an American Hospital Association lobbyist earlier this week. This is a tax cut bill, and it is a tax cut bill with that has healthcare provisions attached to it. So what that means is that this will pass. I mean, there is no question that this legislation in some way, shape, or form will become law because it is a tax bill.
Right, and it drags all this other stuff with it.
Because it is a tax cut bill, there is a 100% chance that this will become law probably sometime in early to mid-July. And so the Medicaid provisions that are riding on it will become a reality. And so for the folks for the providers, for the Medicaid providers that rely upon this Medicaid program as reimbursement for the provision of services to Medicaid eligible recipients, and to the patients that rely upon the Medicaid program, this will become a reality. And most of the provisions that, Charles, you and I are about to describe are mostly unfortunate.
Yeah.
All of it is unfortunate, unfortunately.
Yes, we're going to go through that in a moment. So again, you said to back up. I'd like to back up also and just ask, okay, as far as the timetable, where is the bill right now?
So Charles, it passed the House just before Memorial Day. As we sit here this afternoon, it is the 20th of June. It's a Friday. The goal of the leadership of the Senate Republican leadership, led by Senator Thune from South Dakota. Mm-hmm. Charles, why there's a North Dakota and a South Dakota, why there are two Dakotas is a historical anomaly that I still haven't quite figured out, but that's a discussion for another day.
Yes.
His goal is to
Yes.
have this legislation on the floor of the Senate next week, next Thursday. That is the 26th of June, and have it passed the Senate before the July 4th recess. And then it would go to the House. The House would have to pass that legislation, likely sometime in early July. They might keep the
Mhm.
House in to pass it before July 4th, or to pass it sometime that week after, immediately after the July 4th holiday, Charles.
Oh, okay. Well, not a lot of time. So yeah, let's go through the particulars. The CBO scoring. What did they project? I think they recently did dynamic scoring, if I have that correct, which is a whole other set of projections, but which I think came out even worse as far as its impact on Medicaid enrollment. So, what does the CBO come out as far as that goes?
So just to clarify for your audience, Charles. So the 1974 Budget Control Act created the Congressional Budget Office, and that is a group of nonpartisan actuaries. That's actually what they are. They're just a series of health economists and actuaries, in this case, that attempt to assess the cost of the legislation that Congress considers. It's across. Now, this legislation, the one big beautiful bill or the one big ugly bill, whatever your angle is, has tax provisions, defense provisions, immigration provisions, and these Medicaid provisions, these health provisions. So when you put them all together, the last Congressional Budget Office score, the last CBO score that I saw, when you add in the interest on the debt, this legislation will add $3 trillion, more than $3 trillion with a T, to the federal deficit, to the federal debt, actually, over a period of 10 years. So it will be a very significant, what used to be called, Charles, back in the day, a budget buster. And then when you look at the Medicaid program, if you just look at the Medicaid analysis, not good. Now, so this is designed, the Medicaid provisions, Charles, are designed to pay for the tax cut. That's what the Medicaid is. That's what the Medicaid savings are. They're designed to pay for the tax cut. It is what it is. And that's not an ideological statement. That's just math, right? That's
Right.
just the way it works. So it saved, coming out of the House, about $625 billion in Medicaid spending. That was about 10% below Medicaid baseline. It got worse between the House and the Senate. The latest text that I saw from the Finance Committee, it probably, the Congressional Budget Office hasn't scored the latest Senate text yet, Charles, but my God, I mean, just eyeballing it to look like it was a $900 billion, $800 to $900 billion Medicaid savings, probably costing, just in Medicaid loss coverage alone, probably, I mean, I'm just guessing here, 10 million people will lose their Medicaid coverage alone, based upon the provisions that we saw in the Senate text on Monday.
And from what I've seen, it's fairly evenly divided. People who voted for Trump, registered Republicans, Democrats. Have you seen that? I saw something just earlier today that seemed to indicate that's pretty close as to how many people are going to lose coverage or in jeopardy of losing their
Oh,
coverage.
yeah. Well, so here's the thing. I mean, and again, Charles, I don't know the listenership of the Catalyst podcast, right? So and again, I don't mean to be overly political here. Okay. So this is just the reality of it. All right.
Well, as you said, it's math.
Right. So it's just math. So the red states, Florida, where you're broadcasting from, Texas, Louisiana, Missouri, Mississippi, Georgia, they just heavily rely upon the Medicaid program to a larger extent because they're poorer states. And so the way the Medicaid program works is that those states get a higher federal match because they have poor economies and a larger number of low-income individuals. And so it's likely that they will get hit harder when the Medicaid program has reductions of the size that I mentioned a few moments ago. So it's highly likely that the red states will get hit harder than the blue states in the reductions we are about to discuss, because blue states have larger economies and are just able to absorb these funding reductions in a better way than red states are. It's just the math.
Right. And again, I want to keep it to math, not necessarily making this a partisan thing, but you almost make it sound like it's a fait accompli that it's going to pass the Senate. But we know that there are some oppositional voices like Josh Hawley,
Yes.
et cetera.
Yes.
What is the math? What is that looking like?
Well,
Is
so
this in fact a fait accompli, or is that
yeah.
performative? Do you think
Well,
ultimately they're going to be brought along?
is it a fait accompli? Is it going to pass? Yes. Will Medicaid provisions that significantly cut the program pass? Yes. So some of the details are now being debated as we speak, right? So
Yeah, which I
one
want
of
to get
those.
into. I want to get into those details.
Yeah. But yes. So this legislation will pass. Medicaid cuts will pass. We are actively debating the details with Senator Hawley's office as we speak. Matter of fact, I'm going to call one of the client's constituents in the state of Missouri as soon as I end this podcast. As a matter of fact,
Well,
so
well,
we're
well,
still
well,
actively
well,
debating this thing.
what does that conversation go like?
One of the things they're trying to do, Charles, and this gets into the sort of the strum and drang of the legislative process, the sausage making, right? Is they're trying to buy off Senator Hawley with a rural hospital provider relief fund. And so I'm trying to get my clients, mental health and addiction providers, into that provider relief fund, right? Because we're going to suffer as much as the rural hospitals are
Right.
if these cuts go through, because with less people in the enrolled in the Medicaid program, Charles, what's going to happen is a much larger number of people with uncompensated care, the uncompensated care patient caseloads, individuals without health insurance will be on the caseloads of these providers. Rural hospitals, federally qualified health centers, mental health and addiction treatment providers, people without health insurance, and then what's going to happen? It's going to hit the margins of all of these safety net providers, some of whom will go under
Right.
without additional federal assistance.
Okay, so these cuts are going to happen. You say now they need to work out the particulars. Let's go through some of those particulars.
So how do I speak English about this? So prior to the passage of the Affordable Care Act in 2010, Medicaid programs did not cover single men and women without kids. The Affordable Care Act solved that through something called the Medicaid expansion. Okay. So in the Medicaid expansion, 40 states participate in the Medicaid expansion. They covered single adults, essentially, right? Single men and women, and up to 138% of the poverty level. That's about, I think it's about $28,000, if I'm not mistaken, per year in income. Okay. So now we feared, and states get 90%. So for every dollar that a state spends on that patient population, of those 40 states that participated, states get 90 cents. To cover that population, states put in 10 cents, okay? So we feared that when we began this debate in January, that would be eliminated in its entirety. Congress didn't do that. But what they did is that they declared war on it, right? A guerrilla war, essentially, is the best way to think about it. So one of the things they did is that they, and I know this is popular. I know it's popular. One of the things they did is, well, let me begin. They said that if you're an expansion state in this legislation, if you're an expansion state, but you cover undocumented immigrants with your own money, 14 states do that. Illinois, New York, California, the big states, then we'll dock you 10%. You'll only get 80%, not 90% of your match. It's the first thing they did in this legislation. The second thing they did, and I know this is very, very popular in the public polling, is work requirements for that Medicaid expansion population. Now, and so it's 80 hours, you have to work 80 hours a month, or you've got to volunteer for 80 hours of community service, or you have to work in an educational, you have to participate in some kind of an educational program. Now, first of all, 60% of the entire Medicaid population works. And then if you don't work, you're going to school, or you're a child, or you're caring for someone with a disability. Okay, so this is a program in search of a problem. And then, there are tremendous paperwork burdens that are placed on this Medicaid expansion patient population. You've got to submit a lot of paperwork verifying that you're working. States have to every 6 months recertify that you're still eligible to participate in the Medicaid program to ensure that the money you're earning doesn't rise to a level that will put you above the income criteria. So every 6 months, you've got to submit your income statements to ensure that you haven't made more money that will cause you to lose your eligibility. So what the Congress is doing here through these work requirements and these re-eligibility requirements every 6 months is that they are throwing bureaucracy at low-income working class people with the goal of throwing them off the program.
Of course.
So in the House provisions, the CBO scoring said that just those provisions, just the work requirements alone would eliminate 5.2 million Americans from the Medicaid expansion, just the work requirements alone. And not because they're not working, but because they can't keep up with the work requirement. They can't keep up with the documentation. So that's the goal of this stuff, is paperwork requirements, not work requirements. That's the way I would characterize it. Does that make sense?
It does. It does. There are a number of other things in this. For instance, retroactive coverage. For our listeners, what exactly is that, and what's being proposed, and how will that be affected?
So Charles, for example, I represent community mental health centers. Okay. Now, there's a lot of social stigma to this day associated with community mental illnesses. Okay. So if you wind up, and again, if your listeners here of this podcast could just close their eyes and recreate in their minds what psychiatric intake at a community mental health center looks like for just a moment. When you arrive at psychiatric intake at a community mental health center, likely you're in a bad way. This is not going to see your primary care doctor, okay? You're likely in some form of psychiatric crisis. If you have a substance use disorder, you're there because things have not gone well in your life. You might have just gotten a life-saving dose of Narcan, and someone has brought you to that facility because you are clearly in desperate need of some substance use treatment after almost dying from an opioid overdose. Okay, That's the type of clinician, that's the type of patient that we see. Okay. So when you arrive at that facility, you're experiencing various crises, either mental health or substance use, that impact your cognitive functioning. Your ability to speak, your ability to listen, your ability to concentrate are all impaired. And so your ability to answer questions about your SSI eligibility, your insurance, even your home address are all impaired. And so the provider can make an assumption that you are provisionally eligible for Medicaid. And then, based upon that provisional assumption, if you're in a non-expansion state, you can then be retroactively eligible for Medicaid for 60 days. In an expansion state, you're retroactively eligible for Medicaid for 30 days prior to that encounter in that psychiatric intake. It used to be 90 days across the board. Okay, that was the prior rule. So that but because they've reduced the retroactive period, you're exposing providers to more lost revenue because you're shrinking the amount of presumed eligibility for individuals that, in the case of the providers I represent, are individuals that are in a bad way, that are experiencing various psychiatric crises, substance use crises, and that are seeking these facilities because they desperately need treatment, not because they are engaged in fraudulent activity, which is the presumption of the provisions that we're talking about here now, Charles.
Yeah, sort of a starve the beast kind of approach to it. I also want to talk about Medicaid fraud provisions. Are there any other items that we should talk about that are in the crosshairs?
Oh my God. Well, look, there are provisions in the bill that have bipartisan support that my clients support. Should there be dead people on the Medicaid program? No. So the legislation prohibits dead people from being enrolled in the Medicaid program. Okay. We're all in favor
Fair
of it.
enough.
So dead people should not be on the Medicaid program.
Could all agree to that.
Dead providers should not be on the Medicaid program. Okay.
100%.
In favor of that. If you've committed fraud as a provider,
you're out of here.
Shouldn't be on the Medicaid program as a provider. Okay.
Absolutely. There's a dog, buddy. That guy.
so we don't have any argument with that, right? I mean, there are provisions that prevent an individual Medicaid recipient from being enrolled in multiple state Medicaid programs. So in the Northeast, for example, you can't be enrolled in the New York and the Connecticut Medicaid program at the same time, for example.
Makes perfect sense.
Right. So you're not going to get in the argument with us about that stuff. That's very straightforward prevention of fraud, illegal activity. We're all about that. But this other stuff, the work requirements, the cutting back on retroactive coverage, the every 6-month eligibility.
It's all like too clever by half.
That is too clever by half. That's exactly right. It's harassment is what it is by a bureaucracy. That's all that is. A very low income people. I mean, Charles, I went to the parade. I went to the military parade here in Washington this weekend. I saw many, many Trump voters. Some portion of those Trump voters are Medicaid eligible individuals, okay? And the milk of human kindness flows through their veins, I'm sure, right? There's probably not a fraudulent bone in their body. They likely need the coverage under this program, okay? And so the forcing them to go through all of this paperwork stuff in order just to get basic health care, to my mind, doesn't make any public policy sense. Now, it makes sense if you're trying to afford a tax cut for a billionaire and you somehow need to pay for it so that the bond markets don't go crazy, which is what's going on here.
Yeah, no, it is an incredibly bald-faced and pretty cynical play. I don't see how you can look at it
Yeah.
any other way. Again, we just touched on is there anything else specifically? Again, we probably can go on and on, but is there anything that we missed that we should talk about?
The war on immigrants, right? So, Charles, my parents were immigrants. I'm the only one in my family born on this soil in the United States. Both of my parents, both of my older brothers were born in Italy, in Naples, Italy. So this legislation has a war, engages in a war on immigrants, on immigrant health care. Now, I describe one provision. So again, expansion states, there are 40 expansion states, 14 of them use their own money to cover undocumented individuals through the Medicaid expansion. And so no state's going to take a 10% hit in order to cover those individuals. They will likely stop providing health insurance coverage for undocumented individuals.
And of course, nobody has considered the so-called unintended consequences of that,
Oh yeah, which is they will not go for regular care until they wind up in the emergency room.
which is very expensive.
Oh yeah, and then I don't know who the hell is going to. Well, state and county government is going to have to cover that because the all of that's going to be uncompensated, right? So, but then there's like all of these related and discrete provisions. So, for example, if you're undocumented, you are ineligible to participate in the Affordable Care Act individual marketplaces, Charles. There are new citizenship verification requirements in the Medicaid program. You have to provide citizenship documentation in order to qualify for Medicaid, even if you're born in the United States. Now, there are concerns there. For example, African Americans in the South, in many cases, have a hard time locating birth certificates. And in most cases, many, many, many Americans, the vast majority of Americans, do not have a passport. So there will be some difficulties in adhering to that requirement. Then if this legislation were to pass in its current form, we covered what were called qualified aliens. So who are qualified aliens? Refugees. Who are refugees? Well, let's see. Charles, got 200,000 people out of Afghanistan when we withdrew from Afghanistan. So these, in many cases, were people that helped us in Afghanistan. Translators, cooks, drivers, fixers. So in many cases, we provide those folks with Medicaid coverage, and we owe it to them because they helped us in Afghanistan. They helped our young men and women on the ground in Afghanistan. Under this legislation, they no longer qualify for Medicaid coverage. Asylum seekers are also qualified aliens under the law, and they would no longer be eligible for Medicaid coverage under this legislation. So there's a kind of, how do I say this? Again, I just want to simplify this for your viewers, for your listeners, Charles. It's a war against healthcare coverage for immigrants in this country. I guess there's another and kinder way to describe it. That's the way I describe it because I think that's the closest to the truth, and I think your listeners deserve the truth.
Right. And of course, low income people on Medicaid.
My God, yeah.
What percentage of, what do you say, the estimate CBO said 10 million will be thrown off of Medicaid? What percentage?
Well, under the House bill, it was 8.6, but they made it worse. So they engaged in provisions in the Senate bill, technical changes with respect to how states generate their state match that put more pressure on state governments, fiscal pressure on state governments to finance the Medicaid program. That made it worse. So it's likely that a higher number of individuals are going to lose their health insurance their Medicaid coverage. Charles, the Guida budget office is estimating that I suspect that 10 million Americans will lose just their Medicaid coverage alone under the House bill when that CBO score comes out, and it's still being developed because they're still debating, Charles, the text of the Senate legislation as we speak, as a matter of fact.
Yeah, this is all pretty terrifying. Apart from working with clients and hoping you get some of these carve outs, what's to be done other than preparing for the worst and being clear-eyed about what this all represents or what the implications are?
Well, Charles, we are, and just right. So we are actively working on carve outs. Yes, for my clients, mental health providers, addiction treatment providers, in the work requirements, there are cost sharing requirements where we are seeking carve outs. We're trying to get into this provider relief fund that would benefit rural hospitals primarily. Any listeners from Maine, West Virginia, Missouri, and I think that there's one other moderate there, call 202-224-3121 and ask to be connected to the offices of Senator Susan Collins, Senator from Maine, Senator Jim Justice from West Virginia, Senator Capito from West Virginia, and say, vote no on the Medicaid provisions. You oppose the Medicaid provisions. That's what I would say, is that there's still an opportunity, to my mind, Charles, to impact these provisions. What's that phone number again? 202-224-3121. And then the names of those legislators again are Senator Susan Collins. That is the main switchboard of the Capitol. When you connect to the main switchboard, you want to be connected to the offices of Senator Susan Collins from Maine, Senator Shelley Moore Capito from West Virginia, and Senator Jim Justice from West Virginia, and Senator Josh Hawley from Missouri, and say, vote no on the Medicaid provisions. Does that make sense?
It makes perfect sense. In fact, I am going to put that information in the description of this podcast. So obviously, want you all to listen to it. But if you want to take a shortcut or at least put the podcast on pause, make a call to your legislators. Please do that. The stakes couldn't be higher. Al, I really do appreciate this. Any closing thoughts? Anything? You already started to rally the troops. So I don't know. In the spirit of sustained crescendo, anything to close this with?
Charles, again, I've been doing this a long time. And what I've been telling clients of late is what you learn in Washington is that there's always another inning. I've lost a lot of battles in Washington. We're prepared to lose this one. But here's the thing, there's always another inning, right? So if we lose in this legislative battle, I want to assure your listeners that, man, the regulatory process, there will have to be regulations issued. A lot of these provisions don't kick in for a couple of years. So there's an opportunity to push back the deadlines. So there's an opportunity, even if this legislation were to pass, for guerrilla legislative warfare to come for many years into the future. So now John McCain said, the saint that John McCain would say, it's always darkest before it goes completely black. And but I would say that there is opportunity, even if this legislation is to pass. So I don't know whether that's like a Panglossian view, whether I'm a hopeless optimist, but I think there is an opportunity to affect the decision-making process, even if this legislation is to pass. Let me end it on that hopeful note.
That's okay. We need a little optimism. Al, I just want to add that you've several times spoken pejoratively about your lobbyist brethren, but I just want to let you know that you are, in my opinion, at least, the exception that proves the rule. So I hope you take that as a compliment.
Not everybody feels that way, Charles, but thank you.
Of course. No.
Charles, I really
Al,
enjoyed
I
this. I want to
know.
do it again.
Yeah, no, actually, I insist because I know, again, as we said at the outset, this is a fast-moving thing, and it's going to look very differently, probably in several weeks or months. So, definitely love to have you on. I know you're doing a lot of heavy lifting for a lot of clients and taking some valuable time out to talk with us about this today. I really appreciate it, Al.
Enjoy it, Charles. Thank you so much.
Today, I spoke with Al Guida, the founder of Guide Consulting Services, a 25-year-old consulting practice that helps corporate, government, and nonprofit clients navigate Washington policy processes to achieve measurable goals. This is Charles Epstein for the Catalyst Podcast. Thanks for listening.